Hey everyone, my name is Allison Lucchese. I'm an associate marriage and family therapist here at Embracing You Therapy, located in Woodland Hills, California. I'm one of the therapists in the group practice that works very closely with individuals who have been diagnosed with OCD. In the past, I've done a couple of videos that briefly describe what OCD is, what ERP is, and just subtle differences between different subtypes of OCD. For today's video, however, I wanted to focus a little bit more on the actual self-care portion of what OCD entails. And so for this video, I'd be focusing on 3 different self-care tips that any individual can incorporate while while they are learning about their OCD and while they're learning about how to manage it. So step number 1, or tip number 1, I should say, is practicing self-compassion. So self-compassion is the best practice against our inner critic, who, again, as our inner critic does, might be speaking to us in a way that causes shame or embarrassment. So self-compassion doesn't mean that we don't get to do our exposures, or we don't get to, again, try to increase that tolerance for the uncomfortable. More so, self-compassion is understanding, it's empathetic, and it's being kind to yourself as you go through the process of learning what your OCD cycle is, as you go through the process of learning what are the obsessions, what are the compulsions. Tip number 2 is to practice mindfulness. So whenever I'm in a session with a client and I start to talk about mindfulness, I always love to ask, what do you think is mindfulness? What is it like to be mindful of something? And there's always a quick little dialogue there, but basically what being mindful is being the observer without judgment. So as you continue and you work through different ERP exercises, so exposures, if you will, I encourage clients to be mindful with what is coming up for them. How is your body reacting? Where are you feeling your anxiety? Are you feeling tense? And again, it's without judgment. And the reason why it's important to be mindful is so that you know, am I making a value-based decision, or am I making a decision based on my fear? So if my decision is being based off my fear, if it's my OCD, if you will, then I'm checking to see if the door is locked 5 times. But if I'm making a value-based decision, I can be mindful and I can acknowledge that, okay, well, right now, maybe this is my OCD. So I'm going to go about my day and I'm going to make the value-based decision of not doing my compulsion. So tip number 3, which I think is beyond important, is building a support system. Whether it's with family, whether it's with friends, even coworkers, if you're comfortable enough, right? It's establishing a good support system of people who will help keep you motivated, people who will help support you both emotionally and physically if needed. It's being able to confide in people and let them know, hey, this is what I'm going through. If you're curious or if you're interested, can I educate you on this? If I happen to do this type of ritual, or if you see that I'm ruminating on something, I could really use your support by doing X, Y, and Z. Building your support system is something, again, will help you get through the times where you feel stuck or you feel as if maybe progress isn't being made, right? By incorporating all 3 of these tips, so self-compassion, being mindful, and relying on your support system, it will get you through the tough days. It will get you through the uncertainties. And again, if you have any questions at all regarding OCD, regarding what ERP is. If you're interested in learning more about the services that we provide here at Embracing You Therapy, please feel free to give us a call for a free 20-minute consultation. Or if you have questions, again, leave them in the comment box below. Hope you all have a great day.